There's another major popular misconception about osteoporosis, but doctors tell their patients the truth about this one. Most people think the disease causes pain. It does not. Not until a bone breaks. Remember, the ongoing bone destruction is normal. It's happening all the time to everyone. It certainly doesn't hurt. The problem with osteoporosis is that the bone rebuilding has failed. Do you have to take my word for everything I've been saying about osteoporosis? Not for a moment. Every website I've checked provides the same description of osteoporosis that I did. Although they all advise women to take supplements, not one actually blames osteoporosis on a lack of calcium or vitamin D. The National Osteoporosis Foundation website, for example, describes bone anatomy and physiology exactly the way I just did. It even has pictures of normal bone and osteoporotic bone. The pictures of the diseased bone clearly show the loss of the protein honeycomb. You can see it. But then they go on to perpetuate the myth that increasing calcium intake is going to prevent or help the disease, as if calcium is going to stimulate osteoblasts. It doesn't. No one claims that it does. They and others do give one piece of realistic advice. Weight-bearing exercises probably do stimulate more bone rebuilding for any given level of testosterone. What does the National Institute of Health say about osteoporosis? Their website also has pictures of normal and osteoporotic bone. Pay close attention to their description of osteoporosis, because right after it, I'm going to quote their definition of another disease. Osteoporosis. The inside, quote, the inside of a bone normally looks like a honeycomb, but when a person has osteoporosis, the spaces inside this honeycomb become larger, reflecting the loss of bone density and strength. Now the other disease definition. They use the word collagen, which is the type of protein found in bone. Blank is softening, quote, blank is softening of the bones caused by not having enough vitamin D or by problems with the metabolism of this vitamin. These softer bones have a normal amount of collagen, protein, that gives the bone its structure, but they are lacking in calcium. Close quote. What disease are they defining? Osteomalacia. Note that when sufficient calcium is the problem, insufficient calcium is the problem. There is no change in the protein honeycomb structure of the bone. The Mayo Clinic website also gives the same description of bone anatomy and physiology. They even indict a sex hormone deficiency as the leading cause of osteoporosis. The problem is they have the wrong hormone, estrogen. It's the lack of testosterone that's the culprit. After a long, semi-accurate description of osteoporosis, the Mayo Clinic, completely ignoring their own presentation, then goes along with the nonsense of advising women to take more calcium. Remember that the Mayo Clinic names estrogen deficiency as the leading cause of osteoporosis, because we're going to come back to that idea a little later. The American College of Rheumatology website also has a section on osteoporosis. They also have pictures of healthy and osteoporotic bone and also advise calcium supplements. Now, let's examine all this. At what age do these organizations say that osteoporosis begins? The National Institute of Health, quote, sometime around the age of 30, bone mass stops increasing, and the goal for bone health is to keep as much bone as possible for as long as you can. Close quote. Note that the NIH, the National Institute of Health, is referring to people, men and women. The Mayo Clinic, quote, your risk of developing osteoporosis depends on how much bone mass you attained between ages 25 and 35, peak bone mass, and how rapidly you lose it later, close quote. The American College of Rheumatology, quote, bone is living tissue that is in a constant state of regeneration. As old bone is removed, bone resorption, and replaced by new bone, bone formation. By their mid-30s, most people begin to gradually lose bone strength as the balance between bone resorption and bone formation shifts, so that more bone is lost than can be replaced. As a result, bones become thinner and structurally weaker. Close quote. All three organizations agree that bone loss and weakening starts around the age of 30. Is it just a coincidence that testosterone loss begins between 25 and 35, and that testosterone is the primary stimulant for bone growth at puberty? Now let's examine this Mayo Clinic's claim that the lack of estrogen is the leading cause of osteoporosis. Are we to understand that women begin to lose bone mass in their 30s, not because of testosterone loss, which is occurring at the same time, but because they're losing estrogen 2 decades before the menopause? Are we to also understand that bone loss occurs in men, not because they lose testosterone, but because they lose estrogen? Surely it's obvious how utterly nonsensical all this is. But that's what happens when you try to ignore the reality of testosterone deficiency. I'll continue the discussion of osteoporosis in the next video. Remember my website, www.thehiddendisease.com. There's a lot of information there, along with medical study abstracts and previously released videos in this series. I'm Dr. E. Barry Gordon. Thank you for watching.